showcase has been a wonderful 2 days. You know, over 600 people have attended from both inside the districts and other services around the state. It's an opportunity to showcase all the wonderful work that we're doing. It's also an opportunity to really reflect on the critical thinking that's going on in the organisation, highlighting all the inquiring minds and how we move research into clinical practice.
The only way we can improve the care of our patients is by continuing to do cutting-edge research and applying that research to the clinical situation. And so this forum is such a great opportunity for all of us to get together and hear what each other is doing and take away that information to help us manage the health of our patients and our community.
I think it's very important once a year for us to just take a pause and see what others are doing and really to celebrate, to showcase. But I have to say the keynote speaker that talked about palliative care, that really left a big impression on me. It's something I've noticed a lot in my clinical practice, that we don't do palliative care very well, that there is a stigma that shouldn't be there. And I must say I was blown away by the data showing that in fact patients who have palliative care as part of their treatment in fact live longer.
The research showcase is really important because researchers are so focused in their field that they don't get to see what other research is happening around them. It's especially exciting to see high school students come in and show their research projects and their posters. Just amazing, the quality of work and the thought that they've put into it.
It's a chance for all the researchers and innovators to show what they're doing, the pathfinders in medical research and healthcare, and we get to hear so many fantastic people and see what they're doing in medical technology or best practice, clinical care or out in the community. It's really wonderful.
The Health and Beyond Research Showcase is so important for Southwest Sydney, bringing our researchers together, letting them network, letting them tell other people about the wonderful work that they've done over the last year.
What these conferences do, other than specialist conferences, look at this broad range of innovations that's happening here. And I think integration of ideas of very different medical disciplines, from students, from young professionals, but also established professionals, international, nationally, is a great way. But also I was very impressed with the diversity of the talks, like Holly talked about how do you do innovations in companies, and then we have this great HIV initiative, and I was at the cancer session where all these innovations in cancer, which is my field, are being presented. So I'm having a lovely time.
The showcase is also a great opportunity for people to come together to actually develop new partnerships, new networks, and so the collaborative work that comes out of it is really fantastic. Wonderful presentations from these young medical students, 19, 20, right through to the older and more mature group, within the organisation. I met two people who literally were doing work in the same area, hadn't worked together, didn't know the different work that they were doing. They met, they talked about their work, and now, into the future, they'll actually create a collaboration that will expand the research that they're doing. That's what research is all about. It's not working in silos, it's working in teams with other groups and expanding the work that you as an individual are doing. So next year, the 6th and the 7th of June, we're going to Bankstown. There is some fantastic work happening there. We want to open it up much more to other districts and other services and the broader community of Southwestern, and encourage them to come along, participate and hear the fantastic work that's being done.